So today's topic is tribonucleation. And I know you're probably saying to yourself, tribonucle what? But if you listen to this short presentation, you'll realize you probably are interested in tribonucleation. So many times patients, friends, or family will ask me, what is the sound that my bones make when I crack my knuckles, or if I crack my neck, or if I even go to a chiropractor and get a spinal manipulation? So to explain that, I want you to think about a bottle of soda. And you know in the bottle of soda, there are gases that are dissolved. You don't see them unless you go to open up the bottle of soda. And as soon as you open up the bottle of soda, the gas bubbles appear, because when you open the bottle, there's a difference in pressure, which makes the bubbles appear within the fluid. So if you think about the joints of the fingers or the joints in the spine, where the two bones meet, there is synovial fluid to provide lubrication so the bones don't rub together. And within that fluid, there is dissolved gases, just like in the bottle of soda. So when you crack your knuckle, or you crack your neck, or a chiropractor manipulates your spine, there is a sudden increase in space, and within that space there's a difference in pressure, and because of that differences in pressure, the dissolved gases form together, just like you clap your hands, and when they come together and meet, that's the sound, or that's the popping sound. And it takes about 30 minutes or so for those bubbles to dissipate and dissolve back into the fluid, because they eventually will do that. And within that 30-minute time frame or so, you'll notice you won't be able to crack your neck or your back again, because the bubbles are still together. And then after 30, 45 minutes or an hour, you could crack it again, cause the sudden increase or difference in pressure, increase in space, and the bubbles will again form and pop, and so on and so on and so on. That could be repeated. Now, the real point of this video is patients or friends or family ask me, is it bad if I crack my knuckles, my neck, or my back, or will I get arthritis? And what may be counterintuitive is you won't get arthritis from cracking a joint. But that doesn't mean it's necessarily good for you. Because many people who are in pain in their neck and back, a solution that they do to try to relieve the pain temporarily is to crack their neck or their back, or they'll have somebody come behind them and crack their back. And they will get temporary relief, maybe. But again, you also get temporary relief by itching as scab. So many times in my experience, what I see with patients are they're in pain, and by them continuing to manipulate, stretch, yank, and pull, they're just causing more focus of attention from the brain on that area. And a lot of times the brain will respond to try to protect that area, because it is irritated, by making spasm. You feel and perceive that your neck or back are tight or stiff, so your solution is naturally to crack it to get that temporary relief. 10 minutes later it hurts again, you feel stiff, so what do? You crack it again, and that gets repeated. It's constant irritation to an already painful area. So while it may not cause arthritis, cracking your neck, back, or fingers, that doesn't mean it's necessarily appropriate for you or good for you. And honestly, if you're going to a chiropractor, you shouldn't keep getting your neck cracked over and over and over and over. In our office, we do use spinal manipulation. It's on a limited basis, and there's certain patient criteria. If the patient fits it, and if the patient actually wants a manipulation and safe for them, we will do it on a limited basis as part of a comprehensive program that they're going to have to do as far as exercises or stretches. So whether you're cracking your own neck or whether a chiropractor is cracking your neck over and over and over, it's not always a good thing to consistently get a manipulation or a cracking. But like I said, it won't lead to arthritis. And again, that doesn't mean it's necessarily good for you or appropriate.